I, and I'm heading the departments of medicine and critical care at Supreme Hospital, Chamud Village. There's been a gamut of literature and talks on various disease forms and processes throughout the world for many, many years. Today, I would like to address a very pressing issue that has gripped the world everywhere. All the people that are suffering from diseases is unsurmountable. In today's world, where medical science has made tremendous advancements in leaps and bounds with the help of some groundbreaking technology, but the incidence and prevalence of disease, any disease for that matter, is much higher now than ever before. And the mean age for diseases which previously had incidences after the age of, say, 50 or 60 years has drastically dropped by at least 30 years now. Many may argue that there weren't adequate statistical measures earlier, or the diseases were underdiagnosed or underreported. But today, we are observing cardiological, cardiovascular, neurological, autoimmune, spinal disorders, and even cancers in younger patients. Advancements in technology and medical research has definitely helped us in timely detection of the diseases or their treatment. But complete cure and the detection or elimination of chronic disorders is still elusive. This is actually a very pressing issue, and my question is, how did we find ourselves in a situation such as this? We live in a time where we are blindsided by globalization of economy, industry, trade, cultural exchanges, technological growth, which has led to severe and drastic changes in environmental factors almost beyond repair. The air we breathe is polluted, the waters we drink is polluted, there's radiation exposure everywhere, the foods we eat contain a whole lot of chemicals, more than the food material itself, either in processed form or as pesticides. The human body has done a masterful job in fighting and warding off all these insults on a daily basis. But at some point in time, it will give up and disease will prevail. The evolutionary graph of human beings is on a downward slope, no matter how advanced we think we have become. This needs to be addressed at the core individual level. Each person needs to take stock and charge of their personal health goals on a daily basis. The very fundamentals of healthy living has been forgotten. Things such as proper diet and hydration, adequate exercise, adequate sleep and rest. These seem very basic and probably uncool to many, but at the very core of the human body, these are the most essential and important aspects for good health. I would like to start and speak a little in detail about hydration first. 70 to 80% of our body is water. The very basis of all cellular anatomy and biochemistry is water. Our blood is about 92% water. Therefore, it is extremely, and I reiterate, extremely important to hydrate yourselves well throughout the day. A minimum of 2 liters, at least that is approximately 8 glasses of water, is good. But depending on climatic and weather conditions, this may increase during the summers or drops down during the winters. But at all times, it should be at least 2 liters per day. There are certain mandatory fluid restrictions in people with organ failures, heart failure, liver failure, kidney failure. But even in these conditions, hydration is important. I'm going to talk about food and diet now. The allure of packaged food and street food is on the rise. But remember, these products aim for 2 important things to even stay viable in the market. First, unique taste. And the second is shelf life or longevity. And how do you think they achieve this? Chemicals, which are usually approved and deemed harmless for the body, but that is only because your liver is very, very strong and very benevolent. It will do everything it takes to keep you safe until it cannot. Eat as much of natural foods, fruits, vegetables, nuts, fish, from proper and authenticated sources. And eat fresh, not stale. Packaged food, street food will always be stale. Next, coming to exercise, adequate exercise, by very means of the design of the human body, our musculoskeletal system, the cardiovascular system, and the metabolic system are directly and indirectly dependent on movement, locomotion, exercise. If there was no use for exercise, we would not require such an elaborate musculoskeletal system. We might as well be born as slugs. But one must exercise for at least 30 minutes every day, freehand, and in incremental fashion. Coming to sleep, adequate sleep, the importance of sleep cannot be undermined here. One cannot even begin to state how important sleep is, and that too at a proper time, because there are certain diurnal variations within the body which follow a certain day and night pattern. There are hormonal secretions which increase during the morning hours, go down during the night, and staying up at night, it changes the entire pattern. Adequate sleep, if people do not get that during the day, the bodily functions do come down. Regeneration and repair happens during sleep, and especially during the night. It is very important to get adequate sleep, at least 6 to 8 hours at night. Thank you very much. See, Ashish Sharma writes, what environmental factors affect health? There are a lot of environmental factors right now. There's pollution in the air, there's pollution in the water, there's pollution, even our food is polluted. So there's radiation hazard everywhere. So these are all environmental factors which directly or indirectly affect our health. We take it for granted that there are these newer companies, newer products coming out in the market, and they're safe and they're research oriented, but that's not true. Even if they are packaged, they are processed. There are chemicals added to them to keep them, keep the longevity on, and to provide the taste. So these are certain environmental health factors which we need to consider going forward, because your body, it is just a matter of consumption. When you consume something, your body has to process it. It may be harmful for you. Jogender asks, is there a relationship between air pollution and COVID-19? Well, there are a lot of chemicals that are being emanated into the air. There's pollutants. That kind of keeps the air that we breathe is heavier. There's lower oxygen concentration at the ground level, and there's a lot of pollutants which are not cleared off. When it rains, there's acid rain. There's a lot of chemicals which bring the chemicals down back to the earth. So COVID-19 is basically an airborne disease. It is transmitted by way of aerosols. So there is not a direct correlation between air pollution and COVID-19, but yes, the air that we breathe in is highly, infested with these organisms which cannot be cleared out completely if there's a lot of pollution. Ashish Sharma asks, how does cell phones affect our body? Well, cell phones operate on the basis of radiation, on the basis of magnetic waves. So at some level, at some intricate level, it does affect the way the cellular functions or the atomic functions, molecular functions behave. So it does affect, in the long term, it does affect our body. Will climate change make the effects of COVID-19 predicted third wave worse? Well, the only thing is that climate change is happening because of all these environmental hazards that we, man, ourselves have created. And COVID-19 is an independent factor, irrespective of what the climate is. The virus is there in the air. It is there. It will cause the disease that it has to. And the factors that enable it to cause the disease is basically, the way people are in society. If they practice means of social distancing and other measures adequately, that prevents the disease to spread. Gopichand asks, what are the health consequences of ambient air pollution? Well, when we're breathing, the lungs are designed in such a way that there's intricate immune system working within the lungs itself. There are cells, macrophages, alveolar macrophages inside the lungs, which are constantly working and fighting to eliminate any kind of pollutant, virus, bacteria, anything that enters our lung. And the respiratory system is a very elaborate system when there's a lot of minute hair, the tracts are lined with small hair, which kind of trap these particles, bring them back out. But if an organism breaches this barrier system and goes into the lungs, there are macrophages there which are constantly working and fighting to keep these microorganisms away. But a time is reached when all these barriers are breached. The macrophages are not enough because either the viral load or the bacterial load is high. And at one point, whatever we are breathing in, either be it unclean AC vents where there's fungus, viruses coming in, it will cause disease. It will cause harm. We cannot avoid these things. Next question is, does human-led environmental destruction contribute to the spread of coronavirus? At some point, we have to realize that all the environmental changes that have happened so far has been because of heavy industrialization and things that we do to pollute our waters. We haven't actually worked hard enough to do anything toward elimination of these pollutants or find a better way to have the environment clean. So the prevalence of coronavirus today, I wouldn't say it's an environmental contribution, but yes, it is there. And certain factors in the environment will enhance or facilitate the disease that it causes in certain ways. Yes. Divya asks, in case we are not able to sleep for 6 to 8 hours, how does it affect us negatively? 6 to 8 hours of sleep is the minimum amount which is mandatory for the body to recuperate, to rejuvenate, to recover from the stresses of the day. And it has to be at a time when the diurnal functions of the body work in a proper manner, which is at night. One may say that I sleep for 8 hours in the day, but how does that affect our body? Because in the daytime, your body is geared up, or it is organized in a way that you're ready for functionality during the day. But it's the nighttime that the body really actually shuts itself down and tries to repair itself. So if you don't get that 6 to 8 hours of sleep in the night, it will cause a lot of stress, added stress, and the body may not be able to recover completely for the next day. And also these stresses will lead to long-term lifestyle disorders like diabetes, hypertension, and other things. Gopichand asks, does exposure to environmental toxins cause cancer? Yes, of course. There are a lot of factors, actually. Environmental exposure of toxins can accumulate within the body, can cause DNA alterations, which then may lead to cancer. There are mechanisms within the body which kind of try to help keep these toxins at bay or to prevent these DNA changes from happening, these mutations. So the body will fight till it can, unless, until a time comes when it will give up, these mutations will happen and then cancer will happen. Yes, it does. Ashish Sharma. My hospital is in Faridabad, Surajkund, Chamud village, and my OPD timings are from 9 a.m. to 3 p.m. Thank you.